Since being diagnosed with systemic lupus, my quality of life has changed.
I'd say it's gone from a 10 to 0.
It was like I got pulled out of my life.
I had to stop working for a couple of years.
I have to go to dialysis 3 times a week.
If I'm fatigued or if I'm tired, I kind of need to take a break or I can't participate in certain activities.
I just simply can't do the things that I used to do.
It changes your entire life.
It's been very difficult.
I had to learn that I was going to get myself through this.
I have to pace myself.
I exercise a lot. I really watch what I eat.
I was so caught up with work and, taking care of other people, not taking care of myself.
And I've learned a lot of ways to take care of myself to make the quality of my life better.
Instead of feeling sorry for myself, I look at ways that I can still feel empowered with the life that I have and help other women and men and children living with lupus do the same.
I have definitely become a stronger person. I appreciate life more.
I'm going to be happy. I'm going to remain positive and just keep moving forward.
Lupus has me, or a part of me, but it's not all of me.
Hope begins here.
Of the Lupus Society of Trinidad and Tobago. We are here to educate you and to make you become aware of what is lupus. My name is Donna Kennedy. Even though we are not able to meet physically as a group, we are always, dedicated to this, this tremendous work as members. So we are meeting virtually, and we are very thankful to technology. So please, enjoy this session, and you can ask questions. We have a very prominent doctor who will be with us, and when he comes on, you'll be able to ask questions and to find out about what is lupus and also its connection to the coronavirus. And I'll be sharing a short little, story about myself. Actually, the lupus has, take away my identity, my relationship, and my finances, but I never allow it, to steal my happiness, which is most important for me. So I will not stay long, but you can get me and my story on the Guardian newspapers at www.guardian.co.tt. So I'll be back shortly. I'm to introduce to you all and to all the World Wide Web. I would like to introduce you to this prominent doctor who is also a mighty man of God, and we are so blessed to have him with us. He is, well known, and he's also a virologist, which is a person who studies, the body and knows so much about the body, and who is a one that will, find out how the body reacts to different viruses. He is Dr. Joel Tilok Singh. Good afternoon, Dr. Joel Tilok Singh. And how are you?
Hello, afternoon, and thank you very much for that warm welcome. Thank you.
You're welcome.
So it is a pleasure, it is an honor to be here. So if I may just add you that I'm not a virologist, but my specialty is internal medicine, and with a subspecialty in the hormones and diabetes, but internal structures, the problems which may affect the internal organs, including the pandemic of COVID-19. Thanks to you, to Clifford, and indeed to Dr. Sweet for allowing me to be a part of this Voice of Lupus presentation.
Great. Well, Dr. Joel, now we're very happy have you here. You took time off. I know you wanted today. I didn't go because I wanted to prepare. I told God, forgive me. Because I know you wanted to prepare to be here with us, and we are very grateful for that, right? A lot of people in Trinidad and Tobago, they have lupus, but sometimes they don't know who to go to. So wherever I go, I would, have action with people. I would talk to them because I'm friendly. And that is how I would find out how people has lupus and who family member has it, who friend has it, who passed away, having lupus for the 18 years. It has been a tremendous and hard journey for me, and not just me, but those who are still alive, because it's a disease that has no cure. And today, persons you can call in and you can ask questions about lupus, and you can also find out, the connection to the coronavirus, which is pandemic, not just in Trinidad and Tobago, but the entire, globe. So, Dr. Joel, the floor is yours. So, take over.
Thank you very much. And once more,
Yes.
you remain a blessing and a leader, not just to the voice of Lupus, but indeed to the country, the region, and the
Thank
world.
you.
May God
Thank
bless
you
you
so
all,
much, Dr. Joel.
indeed your entire family to honor. Thank you. I can see the
Yes,
verb, the
yes.
figure. So I know that you shared a few words about your personal journey and experience with lupus, as there would be so many viewers and listeners to share similar
Yes.
tales of grappling with a problem involving the body's level of immunity. So
Yes.
it's always as if the body is fighting against itself. So instead of fighting off infectious agents like this novel virus that will cause COVID-19, body's antibodies or solely starts attacking the various organs. It's a multi-organ problem, and COVID-19 and lupus are very much alike in that the levels of antibodies start attacking and start producing a host of inflammatory substances if somebody is infected with a novel virus called SARS-CoV-2. So this scourge of COVID-19 has afflicted more than 124 million people thus far, and we have seen 2.7 million deaths globally. In Trinidad and Tobago, we have had about 140 deaths thus far since March of last year. So this pandemic year has been really a life-changing experience for all. We've never experienced not just the physical, but the psychological and socioeconomic spillover or effects of this novel virus called SARS-CoV-2. What happens, though, within persons is that most individuals may have mild infections or no symptoms. So we've spoken about the quintessential features like fever, cough, or shortness of breath. But a lot of individuals may have no symptoms, and that may include 4/5 of persons. Now, in a minority of those patients with chronic medical illnesses, such as diabetes, high blood pressure, heart disease, lung disease, and even problems like lupus, rheumatoid arthritis, psoriasis, but the autoimmune illnesses, that umbrella of but the autoimmune illnesses may be at a greater risk for severe infections, for hospitalizations and death, should they acquire this virus, SARS-CoV-2. So most of the studies, and they are limited in terms of patients with the autoimmune illnesses grappling with COVID-19, because it's only a year, it's a novel virus that the world of medical science has had to deal with. And patients with these problems that lower immunity are at a greater chance for hospitalizations, severe infections, meaning that you may end up to the intensive care unit and perhaps on a ventilator, and even death should you acquire this infection. There are many reasons for that, and perhaps the fact that there are lower levels of immunity, which increase the susceptibility to all infections in general, is one. And two, there may be medications. There are medications that are often used in patients with lupus, rheumatoid arthritis, and these are potent drugs that dampen or reduce the inflammatory or immune system, thus exposing the individual to some of the catastrophic complications like pneumonia or septic shock. And that's why it's so important to have a chat with your doctor most of the patients who would be dealing with problems affecting immunity, the autoimmune illnesses, would be under the care of an internal medicine doctor as well as a rheumatologist. Rheumatology is a specialty that deals with many of these joint illnesses, and they may actually have a multidisciplinary team because it's multiple organs involved. They may have a kidney specialist, perhaps a cardiologist or heart doctor may also be involved, the ophthalmologist or the eye specialist, perhaps as a result of the illness itself or the effect of some of the drugs, some of the potent drugs used to manage these diseases. So I know that the floor is open, and if our viewers, or if you or Clifford, Donna or Clifford would like to join in, if there are any specific questions that persons would like to ask with respect to not just the management of some of these chronic illnesses, but also that of COVID-19, the floor is open. Because I know that one of the topics very much in the press has been the vaccine, this essential tool in the therapeutic armamentarium to prevent serious infections in persons remains perhaps the exit strategy to the COVID-19 pandemic. And we have been struggling, at least locally, to have an appropriate rollout of the vaccines. Some healthcare workers were fortunate, and I was one of them, to actually receive the Oxford AstraZeneca jab as a gift from Barbados to 1,000 healthcare workers. And these vaccines are very appropriate for most patients with these autoimmune illnesses, including lupus. But it would be wise to share this with your doctor, with a managing physician, before receipt of this vaccine when it becomes eventually available locally. That these vaccines have not been found to cause a flare of the illness, but the doctor may want to advise in terms of the medications. So if you're on drugs like methotrexate, that's a weekly tablet, you may want to consider taking the vaccine after that dose, or perhaps skipping that dose temporarily if the illness is well controlled. So based on the potency of the drugs, there are many expensive ones. Some individuals would be actually admitted to hospital for infusions, and there are some of these agents that the rheumatologist or your internal medicine physician will want to consider holding temporarily. But these are drugs that should not be stopped on your own. And the Rheumatology Association in the United States actually says that because of the risk associated with a lower level of immunity and serious effects due to COVID-19, that persons with lupus and a host of rheumatic illnesses should be prime candidates to receive any vaccine against the novel coronavirus when it becomes available. Unless you've had a history of a severe allergic reaction to one of the components of the vaccine. And when we received the vaccine locally and throughout the world, persons would usually be observed for at least 30 minutes for any sort of untoward effect. Now, these vaccines do not necessarily, and they have not been studied in terms of trials as to whether or not they reduce transmission from one person to the next. But if we start vaccinating most of the population and we're aiming towards herd levels of immunity, you've heard that term before, no pun intended, herd levels of immunity would mean that 70 to 80% of the population would be protected, so that the chance for transmission would be markedly reduced. And in order to do so, we need to vaccinate a lot more people, because we have not had that sort of level of infection, at least in terms of based on the testing rates that we've seen. We have not had that level of infection. And even in those who may have had the COVID-19 infection and were at the hospital or at home, it has been thought that perhaps 6 months after the infection, you may want to consider receipt of the COVID-19 vaccine as well, because it's unclear in terms of the duration of protection, in terms of the natural antibodies, And this boost from a vaccine may perhaps be better in terms of affording protection. In the United States, if persons have been vaccinated, so it's been thought that within a household that everyone is vaccinated, that persons may mingle 2 weeks after receipt of the vaccine. Yesterday, there was some news that the Prime Minister of Pakistan, who was a former captain of the cricket team in Pakistan, Mr. Imran Khan, he got infected with COVID-19 a few days after receipt of the vaccine. And that's not a matter of cause and effect. It doesn't mean the vaccine was the cause, because he would have acquired that virus a few days before. It's a reminder that the protection afforded by these jabs or inoculations require perhaps about 2 weeks before you start seeing any sort of reasonable antibody response to afford protection. So it does not mean that we should cast aspersions on the particular vaccine that he was administered. It may just mean that he did not have enough time to mount an appropriate immune response. And we'd see that too. We'd see that in persons who eventually receive vaccines, that there would be the potential for infection even afterwards. None of these vaccines are, of course, 100% effective. Persons will be reading, and I know that most of our viewers and listeners are a very literate audience when it comes to this grappling with a pandemic. And most of these vaccines, like Pfizer and Moderna, initially had a 95% efficacy rate. The Oxford AstraZeneca shots that we have had has had about 62% effectiveness in terms of the studies when they were being performed. But the circulation of new variants, because viruses all change and mutate, but this is what they do. They change once you have enough human hosts. And that's why so many prevention strategies are important, despite talking about vaccination. It's not only about vaccines as the only part of the exit strategy. The social distancing, the masks, scrupulous basic hygiene, a rigid tracing program in which persons would be isolated appropriately. Those are all tools in the armamentarium. So it's been said that we should view each arm of preventing infection like layers of Swiss cheese. So each layer is imperfect in that there may be holes in that layer of Swiss cheese. But however, if you stack these layers together, you're going to prevent the virus from infecting the population. In terms of side effects of the vaccines, the novel coronavirus vaccines, most of the healthcare workers locally would have had a fever, perhaps soreness at the site of injection, malaise, weakness, perhaps headaches or muscle pains, but these were transient, very temporary, and were resolved with fluids, rest, and paracetamol. So there were no major side effects. And I know that in parts of Europe, there was a temporary pause in vaccine administration of the Oxford AstraZeneca shot in the last week because of the specter of clots. And most of the agents, including the World Health Organization and the Medicines Agency in Europe, have said that there is no risk for clots so far versus the rest of the population.
Hi, Doc. Someone wants to ask a question?
Certainly.
Yes. So we take your question.
Yeah. What I would like to find out, good evening, Dr. Tilakshing.
Good evening. Thank you for joining us.
What I'd like to find out is why is it after taking the vaccine, one still has to wear mask, observe social distancing, and wash hands after taking the vaccine.
Yeah. Thank you very much for that. It's an excellent question. And if I could reiterate that part, so about the value of vaccinations is that it's going to prevent infections, hospitalizations, and death in the person who receives that vaccine. The studies were not really done in looking at how good these vaccines were in reducing transmission. So there is a chance for someone who has received a vaccine and may actually transmit viral particles in the nose and mouth without any symptoms. So we know that 30 to 40% of persons infected with the virus called SARS-CoV-2 may be asymptomatic and actually still transmit. And some of these persons are actually super spreaders in that they may transmit to many individuals. So the vaccine prevents infection, hospitalizations, and death to the individual who has received it. But the studies are still unclear, and we'll still be getting burgeoning information. There's burgeoning information in the literature about reducing transmission, reducing spread from someone who may have no symptoms, who has received a vaccine and is very well, but may have the nasal passages or the mouth or throat that may actually have some viral particles, and the potential for spread is still there. So thinking about it as layers of Swiss cheese, it's an imperfect layer. There are holes in that layer of Swiss cheese, but the other mitigation strategies like the social distancing, hygiene, and masking will all be effective. Having said that, the Center for Disease Control in the United States has actually said that persons who receive the vaccine after 2 weeks, you may mingle in households. There are households in which persons have all been vaccinated. After a fortnight, you may mingle safely, perhaps breathe a sigh of relief that you don't need to necessarily use masks, at least within that bubble. So it's reassuring, and I think there's hope on the horizon for persons who receive the vaccine, particularly within the household. The problem will remain that after you have received that vaccine, although you may be protected, there is that small chance for viral particles that may exist. So think about it as layers of cheese and with holes, and the more layers that you have is the more that you reduce transmission of SARS-CoV-2. It's a fabulous question. And then if I could also remind that you need at least a few weeks before there is some level of protection. No agent is 100% effective. And as we vaccinate more people, we will see that even if you have received the vaccine, there is a chance that it may not have been as effective in many persons. So as you start vaccinating millions of persons in the world, or perhaps billions of people in the world, and most of the rollouts would be looking at persons in an old age group because they are deemed to be high risk, and those with chronic medical illnesses, you may find that there will be persons who may not have mounted as robust an immune response as others and may still get the infection. And that's expected with any vaccine, that none would be 100% effective. And the more persons get vaccinated, the more likely we will be able to plan the strategy to leave this pandemic. A lot of the new normal, a lot of the changes that we've had to implement, a lot of the freedoms that unfortunately have been curtailed would be lifted as more persons gain herd immunity. And we are nowhere near that level, at least in this country.
Doctor, there's a question.
Sure, Clifford.
The person said, after testing positive, what meds should one take when quarantined?
Once more, it's a brilliant question, as many of the individuals with mild infections are being managed at home. The Ministry of Health has published guidelines in conjunction with the World Health Organization and the Center for Disease Control as to how to mitigate risk, how to prevent transmission to others in the household. And bearing in mind that it's a respiratory virus and it may be airborne, it lingers for longer periods. It's not just a matter of 3 or 6 feet. It may travel distances, and especially in closed, crowded, close contact settings. Those 3 C's that we speak about, avoid them, especially if you have been infected. Home isolation is recommended for at least a period of 14 days. We have moved away from the fact that you need to necessarily repeat a swab after 14 to 21 days. The Ministry of Health actually says in the absence of symptoms that those persons may be managed with liberal fluids, rest. So if you happen to spike a fever at some point, paracetamol. But you also want to be vigilant about warning signs and symptoms of complications. There may be various red flags that you have to inform your healthcare worker or present to an emergency department. even if you're being managed at home. And that would include chest pain, worsening shortness of breath, if you're noticing blueness of the lips or the fingers, if there are changes in your vital signs in terms of your blood pressure, your heart rate. Persons often have glucose meters, especially if they have a history of diabetes. They want to ensure that if that is out of control, they may require admission to hospital. Persons who are being managed at home and you're diagnosed with COVID-19 are actually being given something called pulse oximeters that measure the levels of oxygen in your bloodstream. So it's something that you clip onto your finger, and if your level of oxygen is under 92%, or if you're short of breath with those kind of markers, you may want to consider being admitted to hospital. And of course, chatting with your doctors on the telephone or via some sort of social media is more prudent than presenting into an emergency department if it is not necessary. Of course, sharing of utensils or towels would be discouraged. Bathrooms, if you could have your own bathroom, it would be ideal. And persons were saying too that when you're flushing the toilets, put the lid down on the toilet seat, as this plume of viral particles may actually be found. And it may be found as part of excreta in urine and stools. The viral particles may be found not just in droplets. The whole hygiene theater of actually scrupulously washing down all the surfaces and lysoling everything is perhaps passé now at this stage in the pandemic, as we have actually found that the risk for spread in that manner is perhaps smaller. But in terms of inanimate objects, the risk for transmission is small. But of course, avoiding, if you're outside, avoiding having to touch your eyes, nose, or mouth, as these may be portals of entry for SARS-CoV-2. And hand washing, perhaps, if that's one of the surfaces that you want to clean, it should be your hands when you're thinking about reducing transmission. The problem, though, is that persons who are managed at home will often struggle, especially those with a lower socioeconomic status, may struggle in that it may be hard if you don't have your own room. So if you don't have your own bed or utensils, you don't have your own bathroom, and persons within a household would have to be particularly vigilant. The use of masks, perhaps, if they're in close proximity to the ill person, would all be valuable in reducing spread.
Doctor, someone just sent a WhatsApp message. It's a little long, so let me just read it for you. It says, "Good day. I am a lupus patient, currently having severe hip pain for the past 3 months. I was on 2 mg Dexa and 200 mg HCQ daily when this started to happen. Now I am on 10 mg prednisolone and 100 mg HCQ daily alone with diclofenac, 100 mg daily.
So
I desperately need help."
Okay. Thank you very much. And now, a lupus patient who presents with hip pain may have many causes for this, one of which may include a part of the lupus itself, or maybe part of the illness itself, or sometimes if you've been on steroids, particularly very potent ones such as dexamethasone, there may be changes to the bones and the joint itself, the hip joint. There's one of the complications is avascular necrosis of the hip that may require intervention by a bone and joint specialist, an orthopedic surgeon. It sounds like those drugs, hydroxychloroquine, which many of our viewers from the Lupus Society would be aware of, as it was touted by a former US president as perhaps being a game changer in the management of COVID-19. But we know that most of the scientific research has actually debunked that. That it does not play a role in the management of COVID-19, either in mild, moderate, or severe infections. But steroids do. Steroids do dampen or reduce this cytokines or cascade, this intense inflammatory change, which may occur in patients with severe COVID-19. So it sounds like that patient may need to be screened for the possibility of even joint infections. The problem, avascular necrosis of the hip, has been struggling with the use of medications, including non-steroidal drugs like the diclofenac, non-steroidal anti-inflammatories, steroids like the dexamethasone and the prednisolone, and of course the anti-rheumatic drug hydroxychloroquine. So it may be necessary to not just do some blood investigations to determine what is happening, but also some plain x-rays of the hip. There are special scans like an MRI that persons are often sent for to actually examine the nuances at that joint, and a review by a specialist, an orthopedic surgeon, would be on the cards. And I'd want to advise that patient to present into hospital for a review at the level of the accident and emergency, as that may be best to have an appropriate evaluation and investigations.
Someone just asked another question.
Sure.
It says, is lupus hereditary? Is lupus hereditary?
So it's an excellent one, and we know that there is a genetic component to most of these autoimmune illnesses. Having said that, these multi-system problems like lupus are very often seen in younger persons. I mean, by the age bracket, perhaps 20s and 30s, and women are 9 to 10 times more likely to have it. So there are certain factors that would increase the likelihood. Genetics definitely play a role. We've had some families that may not only have one autoimmune illness, like lupus, they may have another one, like rheumatoid arthritis, type 1, so diabetes, problems affecting the liver or the lungs, vitiligo, psoriasis. So many of these autoimmune illnesses in which the antibodies are attacking different illnesses. Thyroid illness is one that is also quite common, especially in women. You may notice that one family member may have antibodies attacking a specific organ, and another may have antibodies attacking another organ. So you may have a brother with lupus, you may have a sister with thyroid illnesses, and the mother has vitiligo. And very often these are linked to the antibodies, the errant antibodies attacking different organs. So there is a genetic component, and perhaps a lot of our patients will say, but doctor, I don't have any family members with these autoimmune illnesses. It's the first time, it's the first member of the family. And the truth is that perhaps things were brewing and they were never diagnosed in the past. We know that certain factors may tend to trigger or mask these sorts of illnesses. Perhaps stress is one of the common ones that we discuss. That stress in individuals can sometimes be a red flag that then unmasks a latent autoimmune disease.
Doctor, we have another WhatsApp question.
Sure, thanks, Clifford.
It says here, good afternoon to you, Clifford. Good afternoon, Dr. Tiloxing. Pleasure hearing you. I would like to know if lupus patients, given the compromised immune system, can take that COVID vaccine. I think you answered that earlier on, but they may have come on later.
Sure, thank you. And it's an excellent one, and that the rheumatology specialists, the rheumatologists in the United States have actually very recently published recommendations with respect to vaccines against this novel coronavirus in patients with lupus, with rheumatoid arthritis, and that type of autoimmune disease. And the fear is always that there is a potential for a flare of the illness, one, or two, that the vaccine may not be as effective. Persons have been rightfully afraid of allergic reactions to the vaccines, and we read all these fearful videos from WhatsApp and Facebook about some of the complications associated with a vaccine, and most of these have been debunked by the scientific literature. So it's not rooted in science. In fact, there is a paucity of information and studies surrounding the efficacy of these vaccines in certain populations. But what we do know is that if you have an autoimmune illness, you are at an increased risk, as we were saying earlier, of serious infections, catastrophic effects of COVID-19, like pneumonia, septic shock, and death. and of course admitted to hospital on a ventilator. So because of that increased susceptibility, it is thought that persons should afford themselves and avail themselves of any corona vaccine. Any coronavirus vaccine that becomes available is going to reduce the chance for complications. But having a chat with your doctor, the caveat is that having a chat with your doctor as to the timing for some of those drugs that normally suppress immunity, in that you may want to consider using the medications perhaps before you take the vaccine, perhaps a few days or a few weeks before, so that the robust immune response induced by the vaccine will not be reduced by your drugs. So it's something to chat with your rheumatologist or your primary care doctor about.
Dr. Tilak Singh, our social media is firing.
I'm pleased to hear.
The person is asking, is there any particular food chart for lupus patients?
It's a good question, as we always say that some of these illnesses, especially if we're talking about mounting immunity, we always speak about ensuring that you use food that ensure a healthy level of immunity to fight infections and to assist the body in dealing with not just the ravages of the COVID-19, but all infections. We would usually talk about the influenza virus, but there is a plethora of viral, bacterial, and fungal organisms that persons with suppressed immunities, such as those with diabetes and autoimmune illnesses, would find themselves at risk for. So fruits, vegetables, nuts, peas and beans, low fat, low salt, low sugar. And bearing in mind, if I could say that those who have problems with levels of immunity, autoimmune problems like lupus, rheumatoid arthritis, psoriasis, type 1 diabetes, even thyroid illnesses, would want to be careful, because there is a hyperinflammatory change within the arteries for things like lupus and rheumatoid arthritis. And these increase the chance for blockages. So they are potent risk factors for things like blocked arteries, and this whole idea of plaque forming in the lining of arteries would be increased. Just as we talk about diabetes, hypertension, cholesterol, smoking, a family history as being risk factors for blockages or plaque formation in the arteries, those problems like lupus and rheumatoid arthritis, just as they intensely inflame different organs, they may also cause inflammation to the lining of the arteries. So you want to ensure that your diets as well as exercise would be preventing the start of cardiovascular disease. So a Mediterranean type of diet, I think, would be healthy for most of us, based on what you read. And all these websites would say that perhaps avoid gluten, avoid this and that, but staying away, I would think, from fatty, salty, fried, greasy, and of course, sugar is perhaps one of the new poisons when we're thinking about the level of inflammation within the body. And switching your diet towards the fruits, vegetables, the peas and beans, and low fat. And of course, exercise, avoiding a sedentary lifestyle is going to boost immunity as well. So running, jogging, walking, biking for 30 to 60 minutes for most days in the week would not just help your mind, but is also going to rebound into physical effects to lower one's cardiovascular risk.
Well, doctor, I have a few more questions here. But you did mention about boosting your immune system, and I know some people take warm water and rough back lemon early in the morning. How effective is that?
Well, I know that you are a man who is always a proponent of fresh fruits and vegetables, as we have fond memories of the starch mangoes from you, Clifford, and your late wife, who was always such a genial woman and always such a keen proponent for the voice of lupus and indeed the society itself. And rough skin lemon with water, I know it's been touted as perhaps a miracle cure for so many illnesses, but remembering that it's rich in vitamin C, it will definitely help. A lot of individuals find it soothes their stomachs. Persons say that it actually helps things like stones in the kidneys. may not have a lot of medical information or scientific research to back that up, but certainly it can form a part of a healthy diet and boosting immunity.
Okay, I have another one. This person is from Guyana. Okay, and she said here, can you say if my bones can be regenerated after necrosis caused by the steroids, or do I have to have a hip replacement surgery?
Thank you very much for that. As we know, that's one of the complications, as we were discussing from a caller, that it's one of the complications of long-term steroids and indeed some medical illnesses like sickle cell disease, in which, so as a result of changes to blood flow and to different mechanisms, the bones themselves become quite thin. Persons who use long-term steroids are also at an increased risk for osteoporosis, in which the bone density is lower, and they are particularly prone to what we call fragility fractures, in which very minor trauma, perhaps a stumble, may cause a fracture to the ankle, a fracture to the hip, or even the wrist, but the outstretched arms may actually cause a wrist fracture. And those fractures, especially in those who are elderly, that type of fracture, particularly in the elderly, may actually create a cascade or sequence of potentially life-threatening events, including things like clots in the lungs and hospital-acquired infections. So persons on these drugs, on long-term steroids, or even if you have rheumatoid arthritis itself or some of these rheumatic illnesses, would often be sent for a bone density scan and would be started on drugs to actually reduce the risk for osteoporosis and thus the risk for fractures. So there are some medications, but your doctor would want to have a chat with the orthopedic specialist, because if there is pain, reduced mobility, and a reduced quality of life, perhaps a surgical option would be on the cards. But these tablets would, of course, reduce the chance for fractures and indeed are first-line tools in the management of osteoporosis. But a vascular necrosis may require not just physiotherapy and pain management, but perhaps eventually surgery.
Wow, that was a mouthful. We have someone from St. Lucia. Let me just post it up there. He says, hi there, doctor. My name is Adam. Hi, Adam, from St. Lucia. And I'm a big fan. I think he's a big fan of yours.
Thank you.
I'm extremely curious. Can you tell me, is the COVID vaccine safe for children? Is the COVID vaccine safe for children?
That's a fabulous question, and thank you very much to all of our friends in the islands that would be logging in. So not just locally, but throughout the region. I know we've had viewers from St. Lucia, St. Vincent, Guyana, and indeed all the way up to Jamaica would be logging in the Voice of Lupus this afternoon. And good evening to one and all. And the coronavirus vaccine eventually would have to be, I think, administered to children as we start to get a better rollout program. The reason that it is not being administered in that manner globally is that the studies were done in persons more than 16 to 18 years old. Now, infections with SARS-CoV-2 appear to be vanishingly low in children, and most of them make full recoveries. There have been some fears about a multi-system inflammatory syndrome of children, or MIS-C, but we have not seen deaths locally with those individuals, and indeed throughout the region. The risk of death to children is vanishingly low in persons infected with SARS-CoV-2, perhaps because of the fact that they have very strong levels of immunity. And that includes the fact that they very often will not be wearing masks. Their social distancing would not be the best. And it forced school closures at the start of the pandemic. And now is an appropriate point, if I may add, Clifford, as well as Adam in St. Lucia, that there is no reason for schools to remain shuttered due to COVID-19 if the community transmission of the virus is low. And in fact, Children are going to be lost. We are going to have a lost generation of children who will not recover from a faltering virtual learning environment if they do not return to school as soon as possible. The risk is not the fact that children will get ill, but perhaps the other members of staff would have to be careful about social distancing, masking, and of course the Ministry of Health in the given country would have to be particularly vigilant about ensuring that the risk for transmission is reduced in any school, and must be able to close down if necessary if we think that the risk for transmission is increasing within the community. So the simple answer why vaccines are not being used yet in children is that they were not studied, and it's all a novel virus, and these treatment agents are all very new. So it's unclear whether children will definitely benefit or would have a reduced risk for infections, for hospitalizations, and death, because they were not a part of the initial study. The same goes to pregnant women, as we know that they are particularly susceptible to different viruses, including SARS-CoV-2 and influenza. And it would be ideal if we could get a vaccine that would be safe for those two particularly vulnerable members of the community. But perhaps in the next few months, as we get more data and more studies, but the evidence base will burgeon and grow, and we will eventually see that those vaccines would be recommended for both children and pregnant women.
Dr. Sam from Guyana, a question is that the lupus patient has hypothyroidism, as well as lupus. They would like to know if there's any chances of getting pregnant given the fact that they're on so many drugs.
Thank you very much for that. And we know that persons who have one autoimmune illness may often have another. So the antibodies which may attack the different organs, perhaps the joints, the skin, the kidneys, may also attack another part of the body. So one individual may have type 1 diabetes, thyroid issues, lupus, and family members may also have another autoimmune illness. Now, the chance for pregnancy is lower if the thyroid disease is improperly controlled. And likewise, if the lupus is flaring, the chance for actually getting pregnant would be lower. We have seen this, so that your doctor would want to manage you, so your primary care doctor would want to manage you in conjunction with a rheumatologist in terms of the lupus, as well as a specialist for the hormones in terms of the thyroid disease, and even a fertility expert, that if the lupus has remained well managed and the thyroid illness, as you can do blood tests and you ensure that you're on safe doses of medications, your doctor may want to refer you to a fertility specialist if you're finding that it is harder to conceive spontaneously. There are many experts that are available to actually safely not just manage the conception, but also to advise you during the course of the pregnancy. So the chance for conception is lower, and indeed, unfortunately, the chance for miscarriage and complications during the pregnancy, like high blood pressure, your doctor would want to manage you from a multi-system approach. So it's not just looking at blood tests, but also looking at all the complications from medications. You may want to consider switching you to drugs that may be safer during the pregnancy, or even thinking about stopping drugs in the management of the lupus if the lupus is well controlled. So, but these have to be done in conjunction with many specialists. So it's a difficult journey. I wish you all the best in that quest to have a little one, and thank you very much for sharing that with us.
We will take like 5 or 6 more minutes, Doctor. Is that okay with you?
Perfect, Clifford. It's a pleasure.
Okay. Thank you. So our listeners or viewers, we have about 5 or 6 more minutes because this doctor is a busy guy. But I'm very happy that he's sharing his Sunday with us. His Sunday. Okay.
So it's an honor and a privilege.
Yes. So We will take just a few more questions. Post it on your YouTube or on WhatsApp at 393-9950. This is the Lupus Society of Trinidad and Tobago. We have been here since 1988, and we hear about awareness and education. Okay. Do you recommend patients with lupus to visit a lupus center regularly?
Thank you very much. And in terms of a lupus center, of course, perhaps we need more centers of excellence for rheumatological problems in this country, as we have been struggling in terms of persons with these autoimmune problems find themselves as medical orphans, that you're sent to all different specialists. You're attending multiple clinics, sometimes repeating blood tests. You're prescribed drugs often by junior doctors who may not be aware of changes that would have been made in the past. Blood investigations have gone askew, and the monitoring and the management of patients often would be left wanting. So I agree with you that we need perhaps a center of excellence, not just in the Caribbean, but each territory should have a dedicated center to manage not just lupus, but all of these rheumatic illnesses. And the monitoring must be good. The drugs should be readily available. Admission to hospital if there is a flare, and a multidisciplinary approach must be something that would be readily accessible to all and sundry to prevent the complications of these autoimmune illnesses. However, within the clinical practice in the Caribbean, we know that this is not often practical due to cost, and it's a clarion call, I think, for not just the voice of lupus, but indeed that caller, that we need a lot more to be done for the management of these chronic illnesses. We've been speaking about COVID-19 over the past year. It's a new kid on the block, and rightfully it has accounted for terrible socioeconomic, psychological, and physical complications. But we cannot forget the other pandemics, the pandemics of obesity, of diabetes, high blood pressure, heart disease, cancer, strokes, lupus, and these require a lot more funding for appropriate management and care of our people.
Well, another compliment from St. Lucia is that thanks, doctor, brilliant explanation, really appreciate. I think that was the question concerning the kids and the vaccine.
Thank you. Thank you.
I have one more question before we prepare for closing remarks. Mr. David Cooker said, excellent info, Dr. Tiloxing. So you have some fans, Dr. Tiloxing.
Thank you very much, Mr.
And I heard you remember my starch mango tree. Okay, one more.
Season is approaching, so I just thought I would throw it in there, Clifford. So in case
the whole world heard that. Anyhow, someone asked a question. We'll make a post there, and I think I should read a question, okay?
Sure.
Good evening, Dr. Tiloxing and Mr. Balgobin. I recently read in the newspaper where an elderly man went to the San Fernando General Hospital with fever after getting wet in the rain. He was placed in a tent with other patients being tested for COVID-19. Apparently, there was a concern from his relatives why he was placed among persons who were being monitored for COVID-19. Is this normal for this intermingling among COVID and non-COVID patients?
Thank you very much. And that has been a bugbear for many of our patients with chronic illnesses, that there has been an unchecked fear, an unmitigated fear of presenting into hospital. And that's why, initially a lot of our persons with chronic illnesses remained at home at the start of the pandemic in March of 2020, because of that fear of actually going to hospital and potentially acquiring an infection with SARS-CoV-2. So I understand that. And of course, this is why many of these viral tents, the so-called viral tents, should be well ventilated. We know now that avoidance of those closed, crowded settings would be ideal. A well-ventilated arena would reduce the chance for infections. Masks would be essential. And it's a call to it's a reminder that we should be employing more rapid tests in which results are readily available so that persons don't have to spend 24 to 48 hours in a potential petri dish for infection. And we have heard this said that rapid tests are available, and I think that we need to utilize these a lot more at the hospital and health center environments, the district health facilities, in order to determine whether or not exposed persons or those individuals who may have a fever for any cause would potentially be carrying a viral load with SARS-CoV-2. So it's a point that it's a matter for concern. It should be improved, and one hopes that it does not stop those with chronic illnesses from seeking care at a tertiary institution. Do not stay at home if you believe that there are complications, not just related to COVID-19, but all the medical illnesses ranging from lupus to the epidemics of diabetes, high blood pressure, strokes, cancer, heart disease. Present to an appropriate institution. We know that one of the paradigm shifts arising from the COVID-19 pandemic will be the advent of medicine via social media, the telemedicine, in which you're able to chat with your doctor. And I think a lot of our lupus patients would relish an opportunity to actually utilize social media in this manner. And of course, you may have a virtual or free consultation with your physician. And that will actually reduce the chance of actually presenting into an institution and potentially acquiring an infection. However, there's a lot more that can be done to make that viral tent safer, a well-ventilated, masked environment, and of course, rapid tests, so that once you are certain that that individual would have a negative test, that person may be moved to a different area and managed appropriately. Of course, it does not mean, and if I can add this, it does not mean that a person does not have COVID-19 even on the basis of a negative test or a negative swab, but it may perhaps give some measure or some clue that there may be some other pathological process afoot.
Everyone this afternoon. Well, and tell the security guard that I am diagnosed with lupus. I am not supposed to be amongst the general public. And I say, well, I have to go and tell the pharmacists and them that. And sometimes these pharmacists doesn't want to give you the chance. I know that people will be there before me, but I tell them, I said, I can't sit among the general public. It's not that I want to be in front or want to rush them, but it's very dangerous for me and for other persons who have, the autoimmune disease. Do you think that the government is doing much to help us here in Trinidad and Tobago with lupus? Do they pay really attention to us? Because you said that we are medical orphans, and that is true. We are being treated like medical orphans. I see that. Do you think there's something that can be done to help us?
Certainly, I think that there is a lot more that we need. And your point is excellent in that just bringing the humanity back into medicine and healthcare. You mentioned about your visits into hospital and having to chat with guards, having to chat with auxiliary staff. So I often tell the janitors and the guards and the persons around by the hospital that they are the faces of the hospital. They are the first or initial faces that persons and patients would encounter, patients and families would encounter, followed by nurses and then eventually doctors. And all staff at the hospitals need to remember that the human side, the humanity must be brought back into medical care, into clinical care. And there is a lot more that we need to do. There is a lot of financial support. We need to have blood tests available, medications available. We need to have ready access to appointments. When the complications arise, we need more beds for intensive care when we're dealing with lupus patients and indeed all these chronic illnesses. So while we've been speaking about the COVID-19 pandemic over the past year and the needs for admission and all the money has been put into different areas and expansion of hospitals and the different forms of treatments, the truth is that these chronic illnesses have remained lurking in the shadows, undermanaged, underserved, And our patients need to stand up. We need to rise and get our voice literally. It's not just a figurative voice of lupus anymore. We need a literal, a loud, booming voice of lupus so that the relevant stakeholders are able to take heed and to pay attention to prevent all the complications. It's not just about the COVID-19. It's about ensuring a safe, happy, healthy society, not just with respect to lupus, but indeed all of the chronic medical illnesses.
We have center for the lupus patients where we could see, just doctors right through instead of going here, there, and everywhere, and they have you running around like a headless chicken looking for your doctor. And where's my doctor? Yes.
Absolutely. So absolutely.
Yes, what is your idea on that?
Sorry, I didn't quite hear that, but the video was a bit muffled. Would you mind repeating? So I'm not hearing actually.
I was saying is last night I was thinking as you said the question, you posted it to us, that there should be a center just for the lupus patients where we would have to go to the hospital and look for our doctors. Sometimes you can't find them. So, just give like 5 doctors to see about the kidneys, 5 to see about the heart, 5 to see about the lungs. So, you have that center especially for lupus patients. Do you think that's a good idea?
That center of excellence would be a fantastic idea. And I could tell you this, that lupus patients would not just be better managed, but the chance for flares, for complications would be reduced. And I am sure that the lifespan of lupus patients would be prolonged in a center of excellence, a dedicated center with not just doctors, but nurses, pharmacists, ready investigations and medications, all the therapies readily available. I am sure that that would benefit the country in terms of when you think about the money that we spend in all the different hospitals, putting that money towards a center of excellence for lupus and rheumatic illnesses would reduce illness, death, suffering, and if a study were done, it would probably save the country millions of dollars if that center of excellence were to be started and burgeon into something throughout the Caribbean.
At the Lupus Society of Trinidad and Tobago, and who would explain what is lupus. Thank you, Dr. Joel Tiloxing, for all the information and the things that we didn't know, and to our listening viewers and to those who are around the region. I want to say good afternoon to the people of St. Vincent and the Grenadines, who I'm a family member too. Yes, and to our president
is there as well.
So God bless each and every one of you, and may his hands be upon you, Dr. Joel, as you continue to do a tremendous job. You're an example to all doctors, and I pray that the hands of God will reach out to you right now and your entire family. I want to say that we love you here, and blessings to you. Amen.
Thank you. Amen. The feeling is mutual. God bless you always.